Alright, it's time for the bone video. We'll start by talking about the vertebral column. Here are some vertebrae I had in my house. There are different types of vertebrae. How did we tell them apart? We'll start with cervical vertebrae. Cervical vertebrae, all cervical vertebrae, have 1, 2, 3 holes. If it has 3 holes, it's a cervical vertebrae. Let's go with this. It has more than 1 hole. It's a cervical vertebrae, but it should have 3. 2 on the side, 1 in the middle. Is this a cervical vertebrae? No, there's only 1 hole. Cervical. Cervical. It's got 3 holes. Still cervical, multiple holes. Not cervical. All right. Cervical vertebrae have 3 holes. The first 2 cervical vertebrae, C1 and C2, get their own names. C1 is the Atlas. It's called Atlas because in Greek mythology, Atlas was punished by the gods, and his punishment was to hold the world on his shoulders. The first cervical vertebrae doesn't have a body like that. Instead, it has these sort of 2 shoulders there, and it holds your head up. C2 is the axis, and just like the world rotates around an axis, so does your head. C1 sits on C2 just like that. We have a nice little pivot joint right there, and it rotates around that part of C2. This part that sticks up on C2, this extended body that goes straight up, that is called the dens. So C2, the axis, C1, the atlas. Both of them cervical vertebrae. Now there are other types of vertebrae. We have thoracic vertebrae and we have lumbar vertebrae. Now this one is a thoracic vertebrae. How do I know? Well, it's smaller and it's got costal facets. All right, here's the easy way. Thoracic vertebrae all look like giraffes. Can you see it? Helps if you move it. See its giraffe nose and its stupid giraffe face and these things that are on top of its stupid giraffe head. I really don't know what giraffes do, but there's a giraffe. And it's thoracic. You see it, right? Excellent. A lumbar vertebrae looks like a moose. See its moose face and the horns and moosiness. So there's a moose, there's a giraffe. They live together, they love each other, they're very happy. Moose, giraffe. It looks like a giraffe, it's thoracic. It looks like a moose, it's lumbar. Now, let's talk about some generalized features of any vertebrae. And we'll use this handy thoracic vertebrae. Again, it's thoracic because it's giraffe. The bony part right here, the main bone portion, if you will, that's the body. That hole in the middle is the vertebral foramen. These things that stick out to the side, well, those are transverse processes. And the bony part that sticks straight back, that's the spinous process. Now I've got some areas here that are colorful. So we have the body here, and we have these 2 pedestals of bone that hold the body to all the rest of this. Those are called pedicles. Pedicle, pedicle. Here, on either side of the spinous process, are these flat regions called lamina. Lamina, lamina. Pedicle, lamina, lamina, pedicle. Now, we said that our cervical vertebrae have 3 holes. We've got that big vertebral foramen in the middle, and then on either side we have these smaller holes, 1, 2 smaller holes. Those are called, singularly, the transverse foramen, collectively transverse foramina. Foramina is the plural of foramen. So there we see those two transverse foramina, 1, 2, on our atlas vertebrae and the big vertebral foramen in the middle. At the end of the lumbar vertebrae, we have this fusion of vertebrae called the sacrum. These holes in the sacrum are called sacral foramina. Sacral foramen, sacral foramen, sacral foramen. The whole thing's the sacrum. You get the point. At the end of the sacrum, there's your tailbone. The coccyx. That's it right there. Unless it's broken. And it's over there. Coccyx. All right. Moving right along. So, sternum. Now the sternum's a fusion of bones. At the top we have the manubrium. In the middle we have the body. And at the end we have this little pointy part called the xiphoid process. Manubrium, body, xiphoid process. Now this crap out here, this is the costal cartilage that would connect this to your ribs. Manubrium, body, xiphoid process. Costal cartilage, rib. That's a rib. I know this because it looks like a rib. All the ribs look like ribs, with some exception. So that's a rib. There's a whole bag of ribs. We got a lot of ribs. Basically a barbecue joint inside your chest cavity. So lots and lots of ribs. The only rib that doesn't really look like a rib, and that creates some difficulty in identification, is the first rib. There's the first rib. You see, it's kind of flat. Looks like this. Every semester, I've got somebody in there trying to figure out how this is one of the bones of the hand. No, I don't know. So, first rib, it's flat. It sits right up there on top, like so. But that's the first rib. All the rest of the ribs look like ribs, and not particularly full of features that we really care about. How many ribs do you have? Well, there's 12 on either side. Do I care that you can identify the different ribs if I take them off the skeleton? No, I do not. It's not super important. Other questions that come up, yes, men have the same number of ribs as women. No, there's not an exception to that. Some people have extra ribs. They're called cervical ribs, and they're ribs that are further up the neck. Typically, that's a problem later in life. So we're not going to talk about that. So, ribs. One more thing. In our axial skeleton, we've already talked about the skull. We have one more bone left. That's this bone. This is called the hyoid bone. The hyoid bone doesn't really articulate with any other bones. It's right there at the top of your throat. I'm going to take that label off of it here. How can you identify the hyoid bone? It's like a baby vampire jaw. Hyoid bone. Kind of free floating there in your throat. Away. All right. Now let's move out to the appendicular skeleton, and when we do that, we'll start with the shoulder. So here's your shoulder blade, scapula. Look at the posterior side of the scapula, anterior side of the scapula. Anterior side of the scapula, we've got this really smooth place right here. This is the subscapular fossa. Fossa is this round, hollowed out place right there. Muscle sits there. Flip this guy over. On the back, we have probably the most prominent feature of the scapula, this big ridge right there. That is the scapular spine. Come out here and it kind of flattens out into this weird looking protrusion of bone called the acromion. And anterior to that is this pointy part called the coracoid process. In between the acromion and the coracoid is your shoulder socket right there, the glenoid cavity. Now above the scapular spine right here. So here's your spine. Above that scapular spine is the supraspinous fossa. This groove right here, this indentation in the bone. Below the scapular spine down here is the infraspinous fossa. Infraspinous fossa, supraspinous fossa, spine, acromion, coracoid process, glenoid cavity, subscapular fossa, scapula. So continuing with our shoulder theme, collarbone. All right, so this is going to sit, we're looking at the posterior side of this bone here. Do I have the right sides? I do not. Shoulder blade sit like this. Clavicle sits like this. This is horrible because I can't show you on the skeleton in 3 dimensions because mine's taken apart. But here we go. So, clavicle. What you need to know about the clavicle is there's 2 ends. This flat end here, the one that I've got labeled with a 12, and you can see it's kind of flattened, that's the acromial end. It's called the acromial end because it's going to touch the acromion. And again, I can't show you this very well without the skeleton, but it's going to meet out here at the acromion. The other end, the fat round end right there, is the sternal end because it articulates up the sternum. Acromial end, sternal end, clavicle. So now, where's my arm? Humerus. I found this humerus. Parts of the humerus. This part that I've got labeled with 26, that's the head. Now if I take my fingers and I wrap around it just like that, that is the anatomical neck. Here, below all this proximal epiphysis, is the surgical neck. Opposite the head, on the lateral side, we see these protrusions of bone. The furthermost lateral protrusion right here is the greater tubercle. And then here, the smaller protrusion right here is the lesser tubercle. In between the two, we have the intertubercular groove. Head of the biceps tendon goes right through there. About midway down the bone, there's this protrusion right there. You can actually feel it better than you can see it. It's called the deltoid tuberosity. And if we come all the way down here to the other end, the distal end of the bone, we have the widest points out here. These are the epicondyles, the medial and lateral epicondyle. We have these rounded places down here. The medial round protrusion down here. This is the trochlea. The lateral round protrusion out here is the capitulum. Trochlear, capitulum. That small indentation right there, the coronoid fossa. Flip it over on the other side, the olecranon fossa. This is the posterior side of the bone, that big indentation, olecranon fossa. Anterior side of the bone, small indentation, coronoid fossa. Now we take our ulna. The ulna is the bone that looks like an ice cream scoop if you were super desperate. Now this big bony protrusion up here at the top is your elbow. We call that the olecranon, or the olecranon process. This little pointy part here on the other side of that is the coronoid process, which will conveniently snap up into that coronoid fossa. The olecranon process will conveniently go into that olecranon fossa. Yes, I know I've got different sides of the bone. You get the idea. This is the trochlear notch because the trochlea fits in there. Like so. Olecranon fossa, coronoid fossa, trochlear notch, trochlea. Now here we have this rounded indentation. That is the radial notch, named for the head of the radius that's going to rotate there. And then down all at the other end, we have the styloid process. Now let's find our radius. Head of the radius, this nice round place right here. Neck of the radius, just past that. This big bulge right there, the radial tuberosity. Down the other end, we have the ulnar notch, where the ulna is going to fit. And then we have the pointy end right there, the styloid process. And if I manage to get them together right, which I probably will not, we get this idea. The head of the radius rotates nicely in that radial notch. Head of the ulna rotates nicely in that ulnar notch down there. And you can rotate your forearm. Difficult to do with plastic bones and one hand. But radius, perfectly round radial head, radius, ulna, ice cream scoop. Moving on. This is your hand. There's lots of bones here in the hand and the wrist. You'll see there are 8 tiny bones here in the wrist. These are the carpals, and each of them gets their own name. But so very few people care that we're going to collectively call these carpals. I'm not worried that you can name them individually. There's a fun little acronym, and carpals as a whole. Now, the bones in the palm of your hand are metacarpals, the long bones here. And then all your finger bones out here are phalanges. Now, each of these metacarpals gets a number, 1, 2, 3, 4, 5. And each of the phalanges gets a number, 1, 2, 3, 4, 5, and proximal, middle, or distal. Proximal or distal, we're talking about the thumb. We're not going to go through that degree. You should know them all as phalanges, 1, 2, 1, 2, 3, 1, 2, 3, 1, 2, 3. You get the point. And then metacarpals, and then carpals. The hand. Now let's move into the leg. We'll start at the hip, and we'll start with this fun multicolored coxal bone. Now, each side of the pelvis, a coxal bone, is a fusion of 3 bones. And blue here, red, and pink. So, up here, we have the ilium, the ischium, and then in red, the pubis. So the ilium, this big thing right here, this is the iliac crest. This rough place back here is actually where the sacrum fuses in, so keep that in mind as a landmark. So here's the anterior side of the iliac crest, the posterior side of the iliac crest. Looking at it like this. So this nice little smoothed out place that's right in front of this really rough place, this smooth place, is the iliac fossa. If we go to the very back of the iliac crest, where the iliac crest meets that rough, ridgy part right there, this is the posterior superior iliac spine. Now, yes, there's a posterior inferior iliac spine and anterior superior, anterior inferior. We don't care. The only one that I care about is the posterior superior iliac spine. because it's an anatomical landmark, marking the end of the spinal cord proper, where the lumbar vertebrae meets the sacrum. More on that and neuro stuff. Ilium. Now this big notch back here is called the greater sciatic notch. Then we have the ischium, this sort of pink purple thing. That little spine right there is the ischial spine, and this big fat protrusion of bone right here is the ischial tuberosity. The hole here is called the obturator foramen, and then we have the pubic bone. This rough place protrusion of bone out here is the pubic tubercle. Your hip socket is called the acetabulum. Acetabulum, if I remember correctly, is acid bowl in Latin or Greek or whatever. I don't know who named this, but they were crazy. Acetabulum. Obturator foramen. Pubis. Pubic tubercle. Ischium. Ischial tuberosity. Ischial spine. Greater sciatic notch. Ilium. Iliac crest. Posterior superior iliac spine. Iliac fossa. There is your coxal bone. Now, those two bones are going to fit together to make up, right, your pelvis. I don't know if I can make this work disarticulated like this and one-handed. We're going to give it a shot. So that your hip sockets go on the outside like so. So you do get an angle here between those pubic bones down there. This is exceedingly difficult, and I hope you appreciate this. So this angle down here, there. And this actually differs between males and females. And a female, that angle between the two pubic bones is about 90 degrees. In males, it's about 45. So if you ever find a skeleton, you can determine its gender by doing that. You should really just call the cops, actually, if you find a skeleton. And if you bothered to find its gender before you called the cops, I would not volunteer that information. Moving on. The femur, largest bone in the body. The head of the femur, fairly obvious. The neck of the femur, also really obvious. This big bony protrusion that's opposite the head, the greater trochanter. On the back, this little pointy part right here, the lesser trochanter. Down the posterior side of the femur is this ridge we call the Linea Aspera. Down here on the other end of the femur, we have epicondyles, the widest points out here. We have condyles, these smooth protrusions down here. We have a notch right there, the intercondylar sulcus, groove in between the two condyles. The kneecap will sit right here. Incidentally, here's the kneecap, the patella. It sits right there on the patellar surface. Below the femur, tibia. There we have our condyles for the tibia. Here's the tibial tuberosity. Groove in the front, the anterior border, the anterior crest sometimes. This is your shin right there, this ridge right there in the front. Pointy end on the other end. That is the medial malleolus. This is what you think of as your inside ankle bone. Here. That bone on the inside of your foot. Medial malleolus. Still part of your leg. There. So, tibia. That leaves us with this long, worthless looking bone called the fibula. Now, the fibula has two ends. The head is the round, sort of fat end, And the pointy end out here is the lateral malleolus. That's what you think of as your outside ankle bone. So right there. So head, lateral malleolus, fibula. Do not confuse fibula and tibia. Fibula, tibia. That brings us to your foot. Your foot sits like this. Do not do this. This is stupid. It doesn't go like that. How the hell is that even going to articulate? No. Like this. So that you have an arch in your foot, like so. This big bone right here, the heel bone, is called the calcaneus. The round bone up here that's kind of a dome that's going to articulate with the tibia, like so, is the calcaneus. Sorry, talus. Talus, calcaneus. Talus, calcaneus. Talus, calcaneus. Calcaneus is the heel bone. Talus is the articular bone right there. All of these little square bones right here are the remainder of the tarsals. Tarsals. The long bones in your foot are metatarsals. And then just like in the fingers, the little short bones out here in the toes are phalanges. Phalanges, tarsals, phalanges, metatarsals, tarsals, talus, calcaneus, the foot. Are there bones that we've skipped? No, we got the patella, the only thing that could possibly be your kneecap. And we're good. So those are the bones and the structures of the bones that you need for this exam. If you have any questions, feel free to drop me an email. Otherwise, review this and you'll be good. Have a good night.